Hi, I am Dr. Prashanth Acharya, Medical Director, Earth Ayurveda, Indranagar, Bangalore. PCOD. Nowadays, it's heard very frequently in the society. Every doctor, every female knows the details of PCOD. But if at all I take back a few years back, you can see that PCOD was the smallest topic in the biggest book. But today, it is the biggest topic in even the smallest book. Why? Let's first go into the details. What is PCOD? Polycystic ovarian syndrome, or it is also called as polycystic ovarian disease. That means there are multiple cysts on the ovaries. It might be unilateral, that is on one side, or on both the ovaries. Why it is so significant today? Because earlier we used to see this one person in every 50 females, and generally at the age group of 20 to 25. But today, almost 1 in 3 to 5 urban females we see this, which is far and wide spreading. And now you can see that in a 18-year-old girl to a 35-year-old female also. So I used the word urban. Why? Because we see most of these things in urban areas itself. Go 50 kilometers or 75 kilometers away from Bangalore or any urban site, the statistics drop down drastically. Why? We might attribute urban. Yes, the lifestyle, the food, the stress of work. Many of people say that I don't have any stress, but I say in urban areas like Bangalore, crossing a road itself is a stress. Then work stress, family stress, we don't find time for anything. Probably. Yeah, I do have many of my own postulates to tell that, the milk used contains more of estrogen because of induced estrogen and induced milk secretion for commercial purposes, etc., and the type of feed what they give. There are many reasons what I gave, but yes, predominantly we find the lifestyle as a major reason. But the incidences are high in females who smoke and consume alcohol a lot. Coming to the diagnosis part of it, a simple ultrasound can reveal it all. By the way, how does PCOD is detected, or how do you suspect the PCOD? Yes, many a times they come with just a hair fall problem. When we inquire deeply into their symptoms, they come up with probably irregular periods, heavy flow, sometimes repeated periods, sometimes delayed periods, sometimes they get once in 3 months and whatnot. But when we get a ultrasound scan of the abdomen and sometimes of the breast also, the sonomammography, on the ovaries you find multiple cysts, which results in increasing the size of the ovaries also. Sometimes along with that we see fibrocystic changes in the breast also, entirely due to the hormonal change or imbalance, what we call it as. Fine, you have diagnosed. What next? Treatment, right? Treatment. Basically, in Ayurveda, we classify this as kapha pitta vikara. So when you classify this as kapha pitta vikara, we have seen the panchakarma, especially the vamana karma, gives extremely good results in this area. Extremely good result, because it's mainly indicated for kapha pitta vikaras. One good vamana, sometimes followed with a good virechana, followed by some herbal preparations like Shiva Gutika. All these things supports a lot depending on the condition. The duration of the treatment entirely depends on the intensity of the hormonal imbalance or the presentations what the patient produces. Once treated for at least about 3 to 5 months, most of the people come out of this problem. And the main effect of this PCOD, which is sometimes secondary infertility, where they cannot conceive, can be solved by treating this in this manner. Thank you.